our nation's newborn screening system is unsustainable currently, and our babies are at risk. As many here are aware, the legislation that authorizes this critical legislation actually expired 2 years ago. So reauthorizing the bill that we're talking about here today is actually not about maintaining status quo, and the need to reauthorize this bill is extremely urgent. If we can go to the next slide, Shannon. It's also really critical to understand that our system currently does not provide for the same benefit and the same screening for all babies across the country. Even prior to the recent addition of NPS 2, which was the most recent condition added to the National Recommended Uniform Screening Panel, only 17 states screen for all of the federally recommended conditions for newborn screening. I think, Shannon, if you forward one more time, there might be more on this slide. This means that babies across the country are actually not being equitably screened for all detectable and treatable conditions at birth. As John shared in Kate's story, the state in which you're born determines the conditions for which you're screened for and the conditions for which you're offered treatment at birth. So thus, even though there are life-saving treatments available, babies in those states are not receiving the diagnosis they need in order to facilitate an expedited intervention that could lead to an optimized health outcome. We know that newborn screening saves lives. We are a community comprised of families, clinicians, advocates, researchers, public health servants, and policymakers who've seen firsthand what a difference between a timely diagnosis and a diagnosis that follows a long, extensive diagnostic odyssey means. And our community understands that time is a precious commodity and that our newborn screening system is the key to saving both precious time and precious lives. So the Newborn Screening Saves Lives Act is appropriately named. Next slide. And in the years that went into crafting this powerful legislative text, much work was done to ensure that the reauthorization would provide life-saving enhancements that are so critical and so needed by our newborn screening ecosystem. The work to determine what is needed has been done. The legislation has been written. We must pass the Newborn Screening Saves Lives Reauthorization Act into law this year. And while the reasons to do so are many, for the sake of time, I'm just going to highlight 3 important elements of this legislation that reflect the urgency of our community, and when passed into law, will immediately serve to help enhance our current system. First, updates to the Newborn Screening Saves Lives reauthorization will optimize the availability and the ability for every state to screen for all federally recommended conditions as soon as possible. This legislation doesn't solve, but does help address what John just spoke to. Second, the United States is a global leader in newborn screening, but our scientific innovation is outpacing our ability to identify those who can benefit. In the instance of newborn screening, there are life-saving and life-altering interventions and therapies for rare diseases available for conditions that are not yet on the RUSP. In other words, there are life-saving therapies sitting on the shelf while babies endure irreversible disease progression undetected. Currently, the Federal Advisory Committee that reviews nominated conditions is beyond capacity. This legislation provides a pathway to addressing this critical issue. And third, we must continue to look ahead to how we modernize the newborn screening system to address the challenges we are facing, capitalize on opportunities before us, and ensure that our system remains the most successful public health program. To do so, this legislation includes funding for a study to be conducted by the National Academy of Medicine that will address these and other important issues. Again, the Newborn Screening Saves Lives Reauthorization Act is appropriately named. Next slide, please. The current status is that we've had great momentum to date. We must get this bill over the finish line. Please help us to ensure that the Newborn Screening Saves Lives Reauthorization Act becomes law this year. Our nation's newborns are counting on us.